to Australians on welfare in country areas and eventually to some of the poorest people in the world. I joined the pilot scheme for a road test. Jason McDermott and his team are hoping this trip up the Pacific Highway is the start of something new.
When we initially thought about this project, we asked Vision Australia where was the area that needed it the most. We wanted the pilot to be the area that needed it the most. They said the number one place is the region between Port Macquarie and Nambucca Heads. And that's because for the last nearly a decade, this area hasn't had an optometrist that participates in the program. Some people that we're seeing have not had an eye test for 5 years.
Is that bad?
It's terrible. It's like if there was no GP within an hour of your home. Just think of all the health issues that would go undetected as a result.
The trailer they're towing folds out into a fully functioning optometry practice. It has a consulting room with all the tools to conduct an eye test. In the room next door, a mini glass-making factory, which can turn out a single vision pair of lenses in 15 minutes. All this can be run off solar power and batteries, so a patient can get an eye test, a prescription, and walk away with a pair of glasses in under an hour. Well, that's the theory. How many times have you tried this before?
This is the first time. It's a pilot.
So will it work? And do people even want to get their glasses by the side of the road? Bill Whitney is heading for an appointment in Maxville.
Yeah, as I've got older, the vision's got worse. And there is a disease in my family which affects it. They get night blindness, things like that. My brother's totally blind, my sister's totally blind. Yeah, so I was always a bit, the whole family's a bit cautious about their eyes.
Affording new glasses is difficult on the disability pension.
I used to look after people, just personal care assistant. And then I had an accident. And when I was in hospital, I come out and I had a big lump on my neck. Then they discovered it was actually cancer. I had cancer in my tongue and in my lymph nodes, and it's just led to other problems. That's why my teeth are gone, because the radiation therapy done all that. But that's 10 years ago. I'm still here talking about it. But now I'm just at the point where I just can't work. I'm just on the pension and put out the pasture, I guess. But I'm still here, as I said.
That's it, you get a comfy chair right down this way.
Oh, down here, mate.
That's the one.
Yeah.
Alrighty.
Daniel takes Bill for an eye test, free because it's bulk billed.
Let me know which view is going to be slightly clearer. So view 1, 2. So 1, 2, 2, right. And 2, 3, 2, 3, 3, 3, great. And there we have it. So there's your vision there.
Yeah. Yep.
Better, isn't it?
Yes, sure is. Absolutely. Yeah.
Right.
The state government subsidy means if Bill needs single vision lenses or bifocals, they'll be free. But Bill needs multifocals, which require a contribution of $99, which he's happy to pay.
Great, fantastic. If I didn't have this, then my last pair cost me over $700.
It's clear that many are opting to make do with what they have.
These actually were made at the University of New South Wales, way back over 20 years ago when I worked.
Those glasses are 20 years old?
Yes, 20 years old. I got them when I worked at the University of New South Wales at the School of Optometry there.
Okay, Carol? Yes? Hi, I'm Daniel. I'll be doing the eye test for you.
Oh, hello, Daniel.
Come through this way. I'll give you a hand with everything.
Thank you.
Carol McMore spent an hour on the bus to get to the Kempsey site.
And let's see how far down on the chart you can see there. Just in the mirror there.
Oh, I see. I'll have to see.
Yeah, you're all right.
I can't distinguish any of those letters.
There you go. Do you see that now?
The battery-operated equipment allows the same tests as in a normal optometrist.
Not quite a teddy bear. There is a a fair difference between what you had previously to your current prescription. So when you
Carol
get the new
discovers
glasses,
she
even though
needs
it's
2
overall
sets of
very
glasses.
good, just to summarise. So we've got single vision distance and some single vision near glasses.
We can do it today.
Great. So what's the result today for you?
$30.
So you have to pay $30. You happy?
Two pairs of glasses.
But I get 2 pairs of glasses today.
While the glasses are being made, the subject of services in the area comes up.
We get missed out a lot. They bypass us
Why do you think that is?
because the low-income earners.
But the services are not
Yeah,
quite there?
Exactly. We need more services. Yeah. The government needs to come and look and see and talk to people more.
I like those.
Pretty nifty?
Yes, they are.
How's the vision?
Yeah,
Good.
It's not just about free or cheap glasses and improving vision.
Yeah, I can read.
It's about equality of access. Getting to the people outside the major cities, people entitled to the same care, but who are not being serviced.
And we're able to do 15 patients a day. That's literally not even the tip of an iceberg for the number of people that are out there who need this, even just in the Port Macquarie, Nambucca Heads area alone. We're looking at thousands of people who need this service just in this area. If you think about the rest of New South Wales, the rest of Australia, the numbers are astounding. And ultimately, we'd like to be able to take this dispensing bay anywhere in the world.